Episode 7, Combination Therapies, Ribavirin and Interferons in Long COVID. Welcome back to Ribavirin Reminiscence and Lingering Load in Long COVID-19. I'm your host Anushka, and today we are peeling back a lesser known layer of the post-viral puzzle. Think of viral infections as tempests, swift, violent, and often destructive. But once the storm passes, we are often left with invisible debris, fatigue, brain fog, pain. The sky is clear, but the internal weather stays turbulent. These are post-viral syndromes, and ribavirin, the old antiviral war horse, has quietly ridden through many of them. Joining me today to help dissect ribavirin's legacy in such chronic post-viral landscapes is Saakshi, a microbiology graduate with a sharp eye on viral persistence and immune response. Aftermath. Saakshi, welcome to the show.
Thanks, Anushka. I am glad to be here. This is such an important and often overlooked conversation in infectious disease recovery.
To anchor our conversation, let's define the shoreline. Post-viral syndromes, are they just slow healing or something more structured?
A very relevant question. A post viral syndrome is not just delayed recovery, it's a distinct clinical entity marked by persistent symptoms, often systemic, that outlive the viral replication phase. These include fatigue, cognitive dysfunction, myalgia, mood shifts, and even dysautonomia. Mechanistically, it's less about the virus sticking around and more about the immune system behaving like a smoke detector stuck in overdrive, triggering alarms long after the fire is out. Persistent inflammation, mitochondrial dysfunction, and residual tissue injury all contribute.
So the viral flame goes out, but the embers smolder. Let's look at Lassa fever, where ribavirin has been a key treatment. What echoes of illness do survivors experience?
Lassa survivors often report long term fatigue, hearing loss, and cognitive drag. These are not merely scars from severe disease, they point to more systemic fallout. Ribavirin, when administered early, drastically reduces mortality. But its legacy does not end there. Some evidence suggests ribavirin might contribute to post-viral fatigue due to its mitochondrial toxicity. Think of it like extinguishing the fire, but in the process, smothering some of the internal wiring. The evidence is sparse, but raises critical questions. Are some of the lingering symptoms truly vital in origin or side effects of life saving intervention?
Let's follow ribavirin's trial to hepatitis C, a slow burn viral infection with its own long shadow. Even after clearing the virus, many patients left unwell. Why?
Yes, during the interferon ribavirin era, patients achieving SVR or what is known as sustained virologic response often still experienced fatigue, depression, and mental fog. Initially, this was chalked up to interferon's intense cytokine like activity, but ribavirin isn't innocent. It depletes red blood cells, affects mitochondrial function, and can destabilize cellular energetics, which affects cognition and mood. What's tricky is that few studies followed patients long enough to differentiate drug toxicity from true post viral syndromes. So, we are left with a blurred photo. but it's clear something more than the virus lingered.
From chronic to acute, let's glance at high impact infections like Crimean Congo hemorrhagic fever, also known as CCHF, and SARS, both touched by ribavirin use. What did we learn?
With CCHF or Crimean Congo hemorrhagic fever, ribavirin was deployed quickly during outbreaks, often without robust protocols. Survivors sometimes reported neurological after effects, but we lack control data to say if ribavirin mitigated or magnified those outcomes. With SARS, the picture is more vivid. Ribavirin was used in high IV doses, and patients developed severe hemolytic anemia and electrolyte imbalance. Anecdotal reports of post SARS fatigue emerged, but again, separating viral insult from treatment side effects is like trying to unbake a cake. These cases highlight a recurring dilemma, which is ribavirin might act like a fire extinguisher that, while dousing flames, leaves a chemical residue that's hard to clean.
As we circle back to long COVID, this massive real time post viral experiment, what wisdom can we extract from ribavirin's older chapters?
Three key lessons come to mind. First one is viral clearance recovery. Ribavirin's success in reducing viral load does not guarantee restored health. Second one is timing and duration. It matters a lot. Early intervention might help, and prolonged use might accumulate toxicity. Third one is holistic outcomes need monitoring. That is, we must measure not just viral eradication, but cognitive function, mood, fatigue, and also quality of life post treatment. With long COVID, we finally have a chance to apply these lessons prospectively with better tools, better metrics, and hopefully more transparency about what these antivirals do after the virus is gone.
Saakshi, this has been a thoughtful dive. Ribavirin, it seems, isn't just a footnote in virology. It's a recurring character whose full arc we are still uncovering.
Absolutely. The challenge now is to balance life saving action with long term wellness, to treat the disease without inadvertently planting new seeds of dysfunction.
And that's exactly where the next leg of our journey takes us. In our next episode, we'll explore how ribavirin interacts with the immune system. Is it just clearing viruses or shaping our immune future? Until then, I am Anushka, and you have been listening to Ribavirin Reminiscence and Lingering Load in Long COVID 19, where the past meets the present to light the path forward. Stay curious and take care.